Hi, my name is Amanda Morgan, and I'm doing a speech titled, We're Women Too. The two words, healthy pregnancy, is something every woman wants to hear. Enjoying the first kicks, taking home that beautiful bundle of joy that you've had the opportunity to bring into this world are all enjoyable milestones that every woman should have when embarking on the journey of motherhood. Unfortunately for Black women, this isn't always the case. Data that was taken between the years of 1979 to 1992 revealed that pregnancy-related mortality rates amongst various races detailed the true gap. The mortality rate for Black women was 25.1 deaths per 100,000 Black women, 10.3 for Hispanic women, and 6.0 for non-Hispanic white women. In 2019, the Center for Disease Control concluded African American women die from pregnancy-related deaths 3 times more than their white counterparts. In a country with world-renowned healthcare, how and why and what is being done to prevent this statement from being true? This speech is intended to shed light, inform, and hopefully ignite a much-needed change to our healthcare system. Studies have shown that for years there has always been alarming disparities amongst the different races, but why? Many believe the socioeconomic status, poor health, and lack of prenatal care attribute to the inequalities amongst the different races. In 2018, multimillionaire professional athlete superstar Serena Williams sat down with Vogue magazine detailing her birthing nightmare. Serena Williams describes how her request for medical help went ignored. She recounts gasping out her words. She said that she feared another blood clot and needed a CT scan and IV heparin, which is a blood thinner. The nurse suggested that Williams' pain medication was making her confused. Williams insisted that something was wrong, and hours after her initial plea for help, a lab test was finally ordered, and an ultrasound was done to address the swelling in her legs. When both interventions turned up negative, she was finally sent for the lung CT that she had initially asked for. It found several blood clots. Now, this is a woman who has the financial backings to have the best medical care, is in optimal health, and made medical staff aware of her symptoms. But despite all of her pleas for help, it still went ignored. If she had not been able to advocate for herself, she may have just been another supporting statistic. Dr. Lisa Hoyer, immediate and past president of the American College of Obstetricians and Gynecologists, said in a statement, "We are missing opportunities to identify risk factors prior to pregnancy. There are often delays in recognizing symptoms during pregnancy and postpartum, particularly for Black women. Obstetric emergencies involving complications like severe bleeding cause most deaths at delivery. Disorders related to high blood pressure accounted for most deaths from the day of delivery through the 6th day of postpartum. Other leading causes of pregnancy-related deaths were cardiovascular disease, which is not typically associated with young pregnant women, but in Black women it is. Heart disease and strokes cause more than 1/3 of pregnancy-related deaths. The CDC found that cerebral vascular events such as strokes were the most common cause of death during the first 42 days after delivery. While all of this information is readily available, there seems to be no actual plan in place to rectify the ongoing issue. In my opinion, there is not just one solution to this problem. First, when attending medical institutions, there needs to be more in-depth lessons for doctors, nurses, technicians to help them recognize early warning signs that afflict women of color. Also, it would be beneficial to provide medical professionals with mandatory communication training that allows them better to understand the cultural differences that they may not be familiar with. Finally, protocols should be implemented so that when staff is confronted with a woman experiencing shortness of breath or pain in her legs, testing to diagnose a blood clot or other medical emergencies would be mandatory and not up to the discretion of medical staff. While acknowledging one's physical health plays a part in their success during and post-pregnancy, your socioeconomic status and the color of your skin shouldn't. We as a people should acknowledge there needs to be a change when it comes to the lives of Black women because we are women too.